Hi, this is Dr. Richard Schulman here in Sarasota, Florida. I'd like to make a few comments today about chronic pain and chronic pain management. I was clinical director of a chronic pain management program for about 3 years, and as luck would have it, I've had to meet the challenge of my own chronic pain and how I dealt with it and managed it. First things first, what is chronic pain? We define chronic pain as pain that lasts over 6 months. The body is designed to heal. Usually, no matter what the situation, whether it's an accident, an injury, or a surgery, within a few months the pain will resolve. When it doesn't, and it lasts for more than 6 months, we call it chronic pain. Notice that I'm talking about chronic pain management and not pain elimination. Trust me, I prefer elimination, but it doesn't work. No matter how good our technology or our understanding of pain, we don't seem to know how to eliminate it. We can numb it with opioids. And for short-term care, for acute pain, opioids are effective. And doctors tend to give far too little pain medicine for acute pain, like post-surgical pain, and far too much for chronic pain. When opioids get involved in chronic pain, often we get two problems: chronic pain and addiction. Patients will say to me, well, the doctors can't find any reason for my pain. Is my pain real? I say, if you go, ouch, then it's real. It doesn't matter where the pain comes from. What matters is the experience of pain. Now, it's clear to me that pain starts with something called nociception. That's a little pressure receptor that we have in our bodies, and if you push hard enough, the receptor will send a signal to the brain, and the brain will go, ouch. But there are two other things that mediate this pain. One is suffering, the other is pain behaviors. When people suffer, they feel worse. It's almost like misery is optional, and if people have a more positive outlook, even if they have pain, they seem to do better. The other is pain behavior. There's a pain cycle where people who are pain patients have a good day, they do too much, the next day they're sore and tired. They have a bad day, they don't do enough. They don't move, they don't get the blood flowing, they don't get their bodies in a place where pain will start to resolve. Pain patients have to move. That's, non-negotiable. You've got to move if you want to deal with chronic pain. There are 5 pillars of pain management. The first 2 seem, common sense: strength and flexibility. People who are strong and flexible will have a much better chance of being productive and dealing with chronic pain than people who are deconditioned and stiff. 1 plus 1 is 2, I guess. The next piece is body mechanics. Pain patients have to learn to move, in fact, relearn how to move, because what happens when you have chronic pain is you tend to guard the body. Well, it makes a certain amount of sense. People are scared of the pain. They don't want to feel it. It hurts. So they move differently. They move oddly. And the odd movements can often create more pain. That's the third piece. The fourth piece is time management. Pain patients are notorious for not being able to manage their time. Well, once again, if you're focused on your pain, it's hard to manage time. We very often had to write letters for people when they went back to work that they had to do, let's say, 10 minutes of stretching or walking, lying down on the floor, something to change the body position, change their emotional state in order for them to work and feel productive. Pain patients and the last one, is stress management. That's the one I'm most involved with. There seems to be a high correlation between the kind of stress that people experience and their levels of pain. The stress could come from anywhere. It could be work, it could be home, marriage, finances. Very often that's an issue with pain patients, by the way. But it could be anywhere. And pain patients don't usually like to talk about it. Talking about it seems to make it worse. You see, pain patients look normal. If you're missing a limb or it's real obvious that you have a physical condition, people aren't going to bug you about why you can't go out or why you're not working or why you're not productive. Pain patients get tired of explaining this. And when you look normal, people assume you're faking. Now, there is an issue of secondary gain, and secondary gain is the idea that you get something for your pain. Very often, the secondary pain is not conscious. People are not aware that they're looking for attention or some other reason. They may be acting out some childhood drama with the pain. Of course, if you're getting a stipend because you've been injured at work, and you may not want to go back to work, that would be a secondary gain for keeping your pain. That might be conscious. It might not. The bottom line is it's a real phenomenon. Very often, trauma is associated with chronic pain. During conditions of trauma, the body encodes mind, body, heart, spirit all at once. And that memory often is encoded at a different state of consciousness than ordinary memories. Think about a car wreck you might have been in. You could have had a lot of trance phenomena. I know I was in a car wreck, and it seemed like what took about a second and a half took around 20 seconds. I was in a time distortion due to the high stress of the accident. I've developed techniques, I call it the emotional shifting process, to work with a body therapist and create exit points for stuck energy in the body that may be causing chronic pain. We've gotten good results with this. If you want to read about it, I have a book called The Labyrinth of Healing, the emotional shifting process, that details the work that I do. The good news is you can manage the pain and have a productive and happy life. I know, I did. Okay? So you got to take care of it because the pain is giving you a message, almost always. Taking care of your body, taking care of your emotions, taking care of your relationships. You got to listen. The pain will tell you something. Listen carefully, and respond. Okay, you can get better from chronic pain, people. So peace out and have a great day.